Hello, everyone, and welcome to today's webinar. I'm not playing a magic trick on you, and I'm not trying to impersonate Jill. She had something come up today, so I'm going to be standing in, and I'm really excited to walk this webinar through with you all. And I have a special guest today. So before we get started, hello, my name is Taylor Danko, and I'm the product marketing specialist here at HR for Health. And today we're going to be talking about unlocking practice efficiency, how you can create an unstoppable team. And so first, let's get some introductions out of the way so that way you can know who's talking to you and why we're the ones talking to you today. And I still want to go over Jill and why her role is so important here at HR for Health. And she's someone that you can always get in contact with regardless. She is our SVP of Strategic Partnerships here, and she has over 10 years of experience developing the HR leading software for healthcare providers and practices. So she will always be available. I'll make sure to include her email when we follow up with you after this webinar, and we'll include the slide deck, any relevant information, emails, and contact. She will be on here. And next, I'm going to hand this over to Dr. Matt, who will introduce himself and DifferentKind.
Thanks so much, Taylor. Super excited to be on with you today. Hello, everyone. I'm Dr. Matt Allen, the CEO and co-founder of DifferentKind, based in the mountains of Colorado, and we build software that helps measure patient experience, and we have a new product that measures employee trust and employee experience. So as we were talking with Jill about this idea, she's like, we have a webinar coming up where we're really diving into some of this. Would you be able to join? And I was like, yes, of course I will. So I'm super excited to be here. Excited to really talk about some of how the data that we collect helps to build into all the things, Taylor, that you have to share today. So really, really excited for the conversation.
Awesome. All right, let's get into this. So I'm not going to surprise you all. I will tell you what's going to happen before it happens. And we're going to start by understanding what do we mean when we talk about practice efficiency. And then we're going to segue into some strategies and tips and tricks that we have to offer for building that unstoppable team. And then what are some tools and best practices to actually implement the strategies that we give you. And at the very end, we will have a Q&A session. So if you're like me and have the attention span of a flea, send in your questions inside the chat, and you can send them at any time, and we'll get to those at the very end and make sure that it's all answered. Please don't feel like you need to wait till the end, and there's no such thing as a stupid question. We will definitely get to them, and if you want to ask after the webinar, that is also available as well. So part one, understanding practice efficiency. So what is practice efficiency and why does it matter? In the context of healthcare and dental practices, efficiency means optimizing all aspects of your operations to deliver the best care with the least waste of time and resources. It's critical because it leads to improved patient care, increased staff productivity, reduced operational costs, and enhanced profitability. So once you start at the middle and reduce the time that it takes for your team, then you can help all the other aspects within your clinic and hopefully make more money, because that's the goal for all of us, right? And so the key advantages of this, why does it benefit you and what can you gain, right? Because we all want to get something out of something. When your practice operates efficiency, the benefits are significant. You'll see improved patient care and satisfaction as your team can focus on more patients and less administrative tasks. Increased staff productivity and morale come from the streamlined processes and reducing burnout. Operational costs are reduced by eliminating inefficiencies and making better use of the resources you have. And ultimately, this leads to enhanced profitability for your practice. So that was your quick overview, because the best stuff is after part one. So we gave you the part of the syllabus that everyone skips during the first week of college. And now let's talk to you about what are we going to do about this and how do we get you to be efficient? So building an unstoppable team starts with hiring the right people. It's before they even sign contracts, before they get into your door. You want to make sure that you're filtering out all the employees that you don't want and you find the right ones for you. So that way you're starting efficient from the moment that they come in. And you look for candidates who not only have the necessary skills, but they also fit well with your practice's culture. And that's for you to decide on what the culture looks like for you and what kind of personality meshes with you along with that skill set. So that way they can work really hard and play really hard with your team and keep patients happy and other employees happy. And so this is a great part to leverage DifferentKind here. So I'd like to invite Matt to share how DifferentKind's employee experience product can help and this area by measuring trust and leveraging employee feedback.
Yeah, I mean, so Taylor, I think this is like, so as you build your team, right, as you're attracting and selecting the best candidates, to me, hiring has always been, you got to like, it's a sourcing problem, right? You got to go out and find those people. But then B, it's a two-way conversation, right? You're trying to assess them for like how good of a fit they are. And then B, they're trying to assess you. And so some of that is a marketing, play, right? From your side of how do we sell our practice? How do we sell our organization? And I think sometimes people are like, well, it's everyone likes each other and we're all a family and whatever. Like there's these like very anecdotal ways of talking about that, which is fine. That's okay. But I think if you have data that says, hey, 90% of our employees feel like there is alignment between the leadership's values and the employees' operationalization of those values, or 95% of our employees feel like they're treated compassionately here. So if you're looking for a place where compassion is valued, this is going to be the place for you. And so when you have some of that data that you've been collecting about employee experience and about trust specifically, you're able to actually go out there and then sell that to the right candidates to say, hey, look, like we think you're the best. Here's why we're the best, and let's work together. So it's not just a one-way street of trying to find that right candidate because they're probably looking, at other jobs as well. Why are you the right office as well? And when you have that data, it makes that conversation a lot more compelling.
I like that. And that's a great point to add into when you are hiring, and you can use a lot of the data that you get from DifferentKind to put into your job posting. I don't know about all of you, but I love to look into reviews before I go anywhere. And using the data from both of us, whether that be with HR for Health, you want to pull the information about a job description, you can copy and paste that, and we have templates for you, and you'll put that in LinkedIn, wherever you want to post this job. But it would be a cherry on top if you add in DifferentKind and show, no, we have the data to back up why our clinic is great, why you should work here, and why you're going to stay working here, because I don't think anyone wants to move jobs right now in this climate.
It's tough. It really is tough. And I think that, when you can pre-promise some of those things based on what, the other employees have, and it's not just anecdotal, that's a really comforting environment to come into, because you're making a huge decision. If you are changing jobs right now, given what you're saying, Taylor, if you are changing jobs, that's a big decision for a lot of people. And so to be able to reduce that stress and anxiety through like, here's what our people consistently say about us, and here's why we're the best. I think that's just such a, it really, that first 90 days, everyone's kind of feeling each other out. And I think it really makes that a lot less like, who are you? Because you're able to share that a little bit more transparently from the beginning.
Exactly. I like that. And part of this hiring and onboarding process is, let's say you found the right person, they're a great fit for you, and you want to bring them onto your team. Once you've hired them, the onboarding process does not have to be that difficult. With HR for Health, we have all of your new hire documents set up for you electronically, and we do that by state and federal level compliance. So that way they can go over to you, you sign them electronically, they come back to you, they're time stamped so you can show that it was done when it was done. And a comprehensive onboarding process sets those clear expectations and helps new hires integrate smoothly onto your team. So it also gives that great appearance and says, we are really organized, we're really efficient, and we streamline everything. It makes that employee feel really valued, and it makes them want to stay there a lot longer, because a lot of turnover happens in those first 90 days. And if you can mitigate that with something simple like a digital onboarding process, that is your best tip for success here on that. And it's essential to provide all the tools and information that they need to succeed from day one. So getting them started right away, the faster you can get them integrated and onboarded onto your team, the faster that they can start working with patients. And having it all digital just keeps it in one place for you. So you're not having to sift through files, folders, electronically or physically, to get them onboarded and ready to go. And you don't have to worry about whether that's on a federal or state level. If you happen to live in California, then you know the joys of employment laws there, and there's something new every day. Don't get a headache or a gray hair over it. It's so not worth it. Have a system and a software like HR for Health to take care of that for you. And we keep going, right? So your employee has started, they're getting the hang of things, you're starting to do some training, they're getting their grasp on the tools, on the regulations, on the team dynamics. But they don't stop there. Like any job, any employee, any student, any person, we're all trying to grow and become better and more efficient at our jobs. And so continuous education and skills development are vital for keeping your team engaged and competent. It makes them more excited to come to work because they're learning something new and they're staying more engaged with what's advancing, whether it be interdepartmentally or technology. They're always wanting to stay involved and learn more. And when you offer that to them, that's an incentive to say, okay, I'm getting more out of this job. That means it's worth more for me to stay here because I'm continually learning more. And so those regular training sessions and development opportunities can help employees grow and it keeps them motivated. So Matt, can you share how different kinds feedback mechanisms support ongoing training and development?
For sure. So I think there's two things here that I want to highlight specifically in the dental vertical. We do have the patient experience measurement tool that we have, and we do that down to the employee level, right? So this is a great tool to assess employee performance, especially during that onboarding period, right? As you're kind of saying, hey, how are you doing initially? But then as you're looking to grow and as you're looking to say, hey, where are the gaps that we're assessing, and it's not just something that we've heard from one person. It's like, hey, here's the data, and here's how we can like lean into that together. So I think that's one piece certainly. But as I look at this from the employee perspective as well, I think about all the ways that the organization is committing to support me, and continue committing to help me actually grow and develop. And I think a lot of times what I want on those things is I want communication and I want transparency around that stuff. And so this is where I think on the employee experience side, to be able to have the data as an organization. So certainly, for one individual, right? Like you're like, we're doing a great job, but like overall as an organization, are you doing a good job of supporting people in terms of their core competencies? And if you're not, how do you actually like lean into that? And how do you actually move the gap on that? And so you need the data, right, to understand like, are we doing a good job on this? Do employees feel supported in their training and development opportunities? And if not, then how can we support them? And I think one of the gaps that we see here, Taylor, in general, right, is that when you look at a lot of, let's say, employee satisfaction, type of data, that's happening once a year. And so if you start in February and they did the survey in January, you're not getting that for 11 months. You have no opportunity to potentially understand that organizationally over the course of time. You only have that one data point. And so, our tool allows practices to collect this data continually, where you're able to say, okay, cool. If we are trying to make a change, let's say we collected some data, learned that we're not doing a good job of this for some reason, and we're working on strategies to actually support them. Is that having an impact? Is it having the impact that we want to see? So it allows for that what I would consider like quality improvement mindset, where you're always trying to improve. But to know if you're improving, you need the data. And so again, just having that data consistently at hand, I think is so valuable.
I love that. And can you give, for my own curiosity too, can you give an example of a time or maybe a client that you've had where they used the data and made changes based on what they saw? What was a specific case scenario that worked really well for them in their practice?
For sure. So I think like you said at the beginning, we're all trying to unlock growth, right? And kind of drive this, hey, like we all want to be better, faster, more, in more places at one time. But to do so in a really human way, right? That's certainly our goal, is to make these interactions as human as possible. Because we all want that in our healthcare. It's a trust relationship, right? And so we had a practice down in Houston. They were struggling. And one of the big areas that like was identified, based on the feedback was really the like cohesion, intra-office cohesion, right? So one hand didn't know what the other hand was doing, and that was pretty consistent, feedback from the patients, especially around how this office was just kind of dropping the ball. And so they were able to kind of come together and say, okay, cool. How are we going to address that? How are we going to solve that? Their ops leader was able to really take an active hand in ensuring that, cool, like here's how we're going to address this. Here's how we're going to solve it. And then they were able to monitor that. And what they saw 2 months after, bringing us on board was their revenue was up 23%. You're like, great, like we all want outcomes like that. It's not every single customer that's out there. And they were probably depressed a little bit in terms of their revenue because they were struggling, right? But you have, once you can identify those spaces and you can actually say, okay, now I have, instead of kind of shooting at the target or the dart or whatever, the thinking like the archery, things or whatever, what's that called? A target? Instead of just like pulling the arrow out of your quiver and like shooting it kind of randomly, right? Like you're able to say, okay, I know exactly where I'm aiming for and I know exactly what I'm doing. And it's much more surgical in terms of the way that you're addressing the problem to actually drive that growth that I think we all want to see.
I love that. That sounds like the epitome of efficiency. Instead of just throwing things at the wall and seeing what sticks, let's try a more targeted approach so we don't have to waste all our time testing to see what works.
There you go.
Let's see. Okay. Teamwork essentials. Fostering a collaborative environment kind of plays off of what Dr. Matt was just talking about. How do you encourage open communication? A collaborative environment is crucial for a high performing team. Encourage open communication and teamwork within your practice because I always think people can read my mind. Unfortunately, that is not true. You have to talk about it. You have to see what works as a team. If you don't say anything, no one's going to know what's going on. And so, DifferentKind measures key areas like competence, problem solving, and care for others, which are essential for fostering collaboration. Matt, can you elaborate a little bit more on this? I know you did a tiny bit on the other side, but what else can you add?
Yeah, for sure. So those are the three pillars. I've kind of talked about this a little bit, right? But like our platform on the employee experience side measures trust, and those are the three pillars of trust. So competence, problem solving, and care for others. Obviously, all three of those involve communication and collaboration, and so we look at very specific parts of each of those, right? In terms of okay, if there is a problem, like how is that being communicated? When we're just thinking about care for others in general, right? Like do people take time to know my story? Like, is there somebody at work that would like be able to say, hey, like this is Taylor and this is who she is and this is what she cares about, right? Like, do people actually take the time to do that? Because I think sometimes a misconception on some of this, Taylor, right, is that we talk about this idea of efficiency, and I think we all want more efficiency in our practices, but it's not always just about forgetting the people that are actually doing the work, right? Like sometimes we have to slow down to go fast. And that idea of being able to communicate well, certainly with the team, as well as obviously with the patients that are coming in, is just so crucial. And so when you can actually do that in various ways, because it's different how you communicate when you're just doing your job is different than how you communicate when there's a crisis, which is different than how you communicate when you're just communicating that you care for somebody else and that you're there for them and that you're supporting them if they're going through a tough time, whatever, right? And so how do you understand like, okay, cool, we're doing a good job of communicating competence. We have policies and procedures and we explain things well and, whatever. Or, hey, in crisis, like we thrive, like we identify the problem, we create the response team, we do whatever, right? Like you can, there's various ways of doing that, but you might be struggling in one of those. And if you just don't have the data, I think that's what we've seen consistently so much around this is it's a guessing game. Of like, we think we need this because of an anecdotal experience potentially that happened 3 weeks ago or 6 months ago. And you're just kind of constantly chasing your tail instead of being able to like, no, like we have consistent data that shows that we're doing well at this. We don't need to spend additional time and resources and energy training our staff or retraining our staff or doing any of that. So I think when it comes to that, you have this measurement. And then when you're talking about teamwork, right, the idea of like leadership trust and the gap between, hey, here's people that are crushing it at the top and here's people that are just started at the bottom. Like, what is that gap, right? And so we call that the trust gap. And I think a lot of leaders have the misperception, the data bears this out. If you ask a C-suite, person, how's the trust at your organizations, or is it a trusting organization? They're like, yeah, we're crushing it. And you ask the people who just started, who are the frontline job, they're like, I don't know what's going on here. I don't, this is crazy, right? So there's this big gap, right? And like the more that you can minimize that, the more that everyone's on the same page, the higher functioning and more efficient everyone.
I love that. And it really pairs well with, I'm sure everyone is wondering, I don't see any questions yet, but how does an HR software come into this? Part of HR for Health and the communication piece with them is imagine how much time you could save if you weren't communicating via text message, phone call, email, whatever it might be, to talk about PTO, sick leave, scheduling, who's on the charts for tomorrow, who is supposed to be there today, who's covering, what are the notes that need to be left over for that shift in case something didn't happen the day before. Minimizing that communication that could take off a couple hours every single day. And it also shows some levels of respect for that office manager at the front who's trying to do a million things at once. And if it's all in one place and it's all digital, so they can sift through it, see who messaged them, see who requested time off, who needs sick leave, who is on medical leave, whatever it might be, it's all in one place. That way that front office manager can help more with patients, can help more with the efficiency of the team behind them, and let the HR stuff be maybe 10 minutes of their day and take that time and use it for other things around the practice. And I love that DifferentKind kind of takes the bulk in the middle parts of the day, the less administrative, and how does that performance, how does that problem solving help directly with those patients? And it's like a sandwich that works really well together. I like it.
Yeah, I like it too. That's awesome. Yes, 100%.
And now for boosting performance. So you've brought the team on, you've hired them, you've gone through some onboarding, and you have found some ways to train them and keep them around. But how do you enhance that performance even more? So how do you empower and motivate those employees? And we started talking about that a little bit with some training. And so empowering and motivating your employees is key to maintaining that high performance. When employees feel trusted and valued, they are more likely to be engaged and productive. And part of that with HR for Health comes from the first part being communicating all of that outside of the gate. So your job description was fully written out and they know what those expectations are, as any job title or job description might need to be. They've signed it and they understand what they're supposed to do. They've looked at the employee handbook. They know the policies, the procedures, what they're supposed to follow, and how to act inside that clinic and inside your healthcare practice. And they know what's expected of them and when they can take off, all the fun, super fun HR things and all the laws that they're supposed to follow. So whenever they are following those rules, they understand them. It's not coming out of left field when we have to use the word no on occasion. Hey, someone already took this day off. We can't give that to you, or you've already used up all of your PTO for that day. Once that communication is resolved and once those expectations are set, then you're not left with probably some animosity of someone getting really upset that you didn't tell them, well, you didn't tell me that was in the employee handbook. Well, you signed it. We have it here for you to show you that. So getting that all done right outside the gate and right early in the first 90 days of hiring and onboarding really makes a huge difference. And it also practices and teaches you how to communicate effectively. And so on the DifferentKind side, Matt, can you share some insights on how trust impacts employee performance based on the DifferentKind's data?
Yeah, for sure. So there's some really interesting data around this, that when employees trust their leadership, they're much more likely to perform their job, effectively at work, right? And it's like a pretty significant number. And so ultimately, when you're building a high performing team, that's a high trust team, right? Like you're able to say, hey, if I make a mistake, I can apologize for that. If we all succeed, no one is trying to claim the success for that by themselves, right? Like those are the very specific parts of winning together as an efficient and high performing team that really rely on that trust. And so ultimately, you're going to have that data to be able to build that team, to be able to say, hey, look, like here's how we're doing, here's where we need to improve, and to be able to share that data back with employees. I think that's one of the things that we see most around this is that, if let's say you're collecting employee experience data once a year, and like it feels like it goes into some ether and no one ever looks at it, right? 'Cause it's like, well, we had to do this. It's a checkbox that we had to check. And now what are you doing with it, right? But if that data is coming in consistently and there's that kind of give and take from the leadership team with the organization and the staff around, hey, here's where we are struggling. How can we improve together? That's one of the things that I think I've seen the most from users of our product. When they identify spaces where they can improve, it's not a unilateral decision then from the leadership team to say, here's what we're going to do about it always. Oftentimes it's hey, let's bring everyone together and mastermind ways that we can solution this and try different things and actually work on it, right? And that is so empowering as an employee when you have the ability to influence not only the direction but the execution of that. You're not just being told what to do, right? You're allowed a voice in that. And so from that perspective, right, you're so much more likely to show up and work harder when those kinds of things are happening. So that's, those are like what we see in the most high performing organizations. Yes, you have to have what HR for Health does 100%. Like you have to have all of that expectation setting and clear communication and all of those things. It is 100% necessary, right? And then if you have, kind of some of the data that actually helps you understand how people feel about it, then that's where things can really start, I think, to get fun and take into the next level.
I love talking about feelings. I think that's a great thing to have a part of it. Speaking of that, I'm kind of interested on how you picked why trust. Why is that something that is really valuable and important to you in DifferentKind when measuring that? How did you find that that was such a, for lack of a better word, such a big deal for employees and higher ups?
Yeah, I think, we started on the patient side there too, right? So it's like ultimately we wanted to measure the things that were going to like to increase loyalty and trust the most. Because you can measure a million things on the patient experience, right? A patient journey through healthcare is very complex. There's a lot of different pieces. And so you can measure things, but some of those things don't necessarily impact whether someone's going to come back and see you again or whether or not they trust you. So ultimately, we wanted to just measure the most high yield things when it came to that, right? And so we went through all the literature and said, okay, cool. How do we what are the things that correlate most with like loyalty, coming back, trust of a patient to a practice? And so then it made natural sense when we say, okay, you can't provide great patient care with crappy employees. Like it's just not possible. And so if we can bring, that piece into it as well, if we can bring the employee trust that's trusting the organization and the patient trust that's created by the employees, it's just this big win-win-win that everyone feels great about. The patients feel great about, the employees feel great about, the organization feels great about it. And so yeah, it was kind of a natural outflow of where we started and kind of answering the question of what makes patients come back. And ultimately, one of the things that makes patients come back is great employees. And what makes great employees stay is they trust the organization that they work for.
I love that. That's a really good North Star to have. Let's do. All right. Part 3, tools and best practices for implementation, which obviously we've already sprinkled a little bit in here, but we'll get into a few last things. And so HR software solutions, oh my God, who could that be? It's us, HR for Health. Let's talk about some tools and best practices for implementing these with our software. So we offer a comprehensive HR software solution tailored for healthcare and dental practices. Yes, we really mean it when we say that. That's not just our marketing pitch. We've really created a software for healthcare and dental, and we made it easy, efficient, and not time consuming for all of you. So we didn't throw in a bunch of features that you're not going to use. We didn't use a bunch of lingo that we just thought sounded cool online, and we wanted to be fitting in with the rest of the HR softwares because we know there's a bunch of them out there. HR for Health is designed to be simple and effective for your team and giving them the least amount of fluff so that way they can get in there, get use out of the software and make the most out of it. And it helps keep you compliant, which saves you some money because no one wants to get sued, especially in this economy. And we want to make sure that your team is showing up when they're supposed to be there and how they're supposed to be there. And so these tools can help you manage your HR processes efficiently from hiring to onboarding to performance tracking. And I know hiring and onboarding can sometimes be used interchangeably, so super quickly. When it comes to hiring, that is part of what we talked about at the beginning, but that's where we're trying to find that talent and bring them in. So that's where you can use our job descriptions that we have templates for in our system. You can copy and paste that, put it onto a job board, send it out to your social network. Sometimes the best are from your own employees. So if you're getting some employee referrals, and then using DifferentKind to see what are the actual numbers behind our practice to show, and how are we going to sell ourselves so that way it looks like you would be so dumb to not even work for us. And we're going to have the numbers to back that up and why you want to stay. And then with onboarding means you brought them on, you've hired them, but you have to give them this portion of time to get used to the company, the culture, the policies, the procedures, all the super fun legal stuff that has to happen because they will find you and they will make sure that you sign all of these things. And they also want to make sure that you're treating employees fairly. We have lots of employment laws and regulations for a reason. Someone was breaking those rules somewhere. They needed to find those rules to put them in place. That way employees were treated fairly because common sense is just not common. We had to make sure that employees are treated really well. And that's where the employee handbook comes in. It's because it's not common sense for a lot of those things, for policies, for your phones on the job. Should you have your camera out? Should you be texting? Should you be talking to someone a certain way? A lot of that isn't common, and sometimes you don't hear it in med school. So that's where HR for Health fills in some of those gaps, and then using DifferentKind to leverage that data to prove, and it helps you as your practice. You have the data to put into the system. how do we make that more efficient and put it together so that way we can sell our practice more and then find the gaps in where we can improve. And so automate, how do we automate some of those tasks? So what are some examples of automation? With HR for Health, you can have all of your time off put into one place. You can sort it based off of the type of time off that it is by the employee. You can also look through unfinished documents. That's one of my most favorite reports because you can pull up all the documents that you have at your practice and you can see exactly who did not fill it out, and it's in bright red, so you can't miss it. You can make sure to follow up with that team member and say, hey, look, this isn't in our system. That means it's not done. It has to get done. And then with scheduling, we have our employee scheduler that we launched this year. You can go and schedule your employees. You can do it from weeks to months. You can copy those schedules. So let's say they work the same all the time. Copy and paste it, put it in, make it easier. And then if there's any notes that need to be left over, let's say someone was closing and another person's opening, you can leave some shift notes at the bottom for that person to get started the next day. Because why? Communication is so important, like we had talked about. So if you leave those notes in there, they don't have to call someone super early in the morning and say, why is this here? Why is this happening? The notes are left over from the day before, and you can make sure that it's in there and that they have it communicated. And then compliance tracking. So with HR for Health, we also do believe in the power of knowledge and letting you know what's going on. So we have a little notification center that tells you about law updates, what's changing in every state, why is that change happening, and when is it going to happen? So you know what documents are coming. And then another one of my favorite features is the recommendations, because sometimes even when I'm writing out presentations related to HR, I have no idea what they're talking about. And sometimes I have to read it a million times, get someone else to explain it to me. With HR for Health, we take that law, we break it down, and then within our software, we have these little badges or like little buttons next to the policies that say, if something is recommended, so we'll say most of our clients have chosen this policy, or based on you being a healthcare practice, which is why it's important to have a software tailored to you, we believe that this is the best way to enforce that policy. And so with the compliance aspects, we break it down so it's easy to understand, because we don't want you to have to be a lawyer on top of being a doctor, because that seems like a lot. So we're going to break it down in a way that's easy to understand and compliant, so you don't have to worry about anything coming to get you later. And so,
Taylor, can I just
yes,
add one thing there too? From the different
please
kind
do.
perspective too. So I've seen some of the existing, kind of ways that people are doing some of the collection around employee experience, and it's not pretty. It's not fun. It's like literally with like some very large DSOs where it's like, this is taking one person literally like a full week to, do all this stuff in Excel and create pivot tables and whatever. It's a nightmare. And so we have built ours to be the same automated fashion, right? Like once you get it set up, all of the like how your employees, how you want to split the data and look at it. I want to see, doctors versus, front desk versus whatever. It's all super easy to look at and do, and you don't have to, knock yourself out trying to, build Excel tables to like really understand this and find them the next time you did it, a year later because you can't find that spreadsheet or whatever. So, it really is, automation is so important in so many ways. So certainly it's something that we've thought a lot about there too.
I love that you used a trigger word, which is DSO. Tell me why it's so important to have DifferentKind when it comes to managing multiple practices at different locations. Why is it that much more important to have this?
Yeah, I mean, I think one of the things that we see in our data is that, organizations struggle with different things, and that can be on certain metrics, right? So whether you're measuring employee experience or patient experience, it's like, hey, we, as an organization, we try to do X, Y, and Z, but we struggle here. But you're always going to have, the kind of a bell curve, right? Where you're like, hey, where are the outliers and where does this look? And especially as you get bigger, right, the number of those outliers inherently becomes larger, even if the bell curve looks exactly the same, right? If you have 100 practices under the bell curve, like there's 10 over here now, you really need to support those 10 practices, and you really need to help, ensure that those employees are getting the experience that they want and desire. Those patients are ultimately getting taken care of. So yeah, 100%. I mean, I think that as you grow, that kind of level of data, not only at an org level, but at an individual practice level, and then an individual provider level as well, to be able to stack rank things and say, show me according to this specific metric how my providers are performing when it comes to patient experience, or show me when it comes to the doctor group here, how we rank on this specific question or something like that. So that's certainly the more people you have, the more power you can have actually in the data there.
And sometimes more problems that you can have too.
You got 99 problems, and certainly, a lot of them are caused by a lot of locations. So
That's why I love having softwares like this. That way it's all in one place, because I could not imagine trying to wrangle multiple offices to find the information that you need. I love that. So as we're wrapping up, we only have a few more slides. And for continuous improvement, I've kind of touched on this a little bit with performance tracking and feedback. Why does it matter to have regular performance reviews? We can do a performance review topic on another time. Long story short, you need to be taking performance reviews. Having those expectations, and I've used that word so many times, don't turn that into a drinking game. You have so many expectations for your team and you want to make sure that they're following them, but it also gives you a chance whenever you are having to put someone on a performance improvement plan, whether you are having to think about, do I need to terminate them? Do I need to promote them? Either way that it goes, by writing down your performance reviews, how they were doing, whether or not they are hitting those milestones within their job description, tells you the next steps. And it also shows you from a compliance level that you have this documented and you have it in one place. And so implementing best practices can help you manage those risks and avoid legal issues, because you can't just fire anyone because you feel like it. And you can't just hire or promote anyone just because you feel like it. You have to have something to back that up. And so our software offers some solutions to have some features where you have templates for performance reviews. You send them electronically so they can complete it on their phone, on their computer. It's really, really easy. And they send it back to you and sign it to say, I read what you said about me. I understand why you said it. And now I'm going to do something differently, or I'm going to improve because of this. And before I move on, I want to make sure, do you have anything to add for some continuous improvement?
Well, when you have the data, right? I mean, we've been talking about the data the whole time, right? Like this is a pretty easy thing from the perspective of on the patient experience side, right? Like if you have that data and you can put that into the performance reviews, it's pretty easy when you're like, hey, you're the lowest performing, doctor in our organization. I'm sorry, this is not working out, right? Or you're, whatever, like, or from maybe it's an assistant or something like that, right? Where you're like, you continually get mentioned as, not being able to deal with the patient's concerns or whatever. So when you just have that data, it makes it so much easier. And it's not, I think a lot of times it feels like, because in healthcare, it's tough sometimes, right? If you're, a doctor, especially in multiple locations, right? Like you're not even there a lot of times. So you don't know. But even if you are in one office, you're in another room a lot of times. You're not always with them. And so it's like, how do you really know? Like, what are the things that you are using to ultimately judge that performance? And so having some of those tools that are third party and kind of, essentially objective, right? Allow you to just be able to put that data in there, in those performance reviews and say, here's where we're at. Like it's black and white,
Mm-hmm. I like it. And compliance and risk management. What are some best practices for this? So you have to ensure compliance on a healthcare level with OSHA, HIPAA. I already know you all know that, but you have to ensure compliance with employment laws and making sure that you are hiring in a legal way, you are firing in a legal way, you are onboarding, everything. We don't just say all of this for fun, and we don't say this to make your lives worse. The employment laws in your state are there and they will enforce them, and they will make sure that you are adhering to all of those. So you want to make sure that you are managing those risks by keeping everything in a software. So the point of HR for Health isn't just to find a way to sell something towards dental and office managers or practice owners. The point is having a digital software. We have timestamps and we're able to even see the IP address behind the computer that submitted that time clock to submit in that punch that I clocked in that day. So you can see, we know your employee can't clock in from Starbucks. We want to make sure that they're actually at the practice. They're there, they're on time based on when you tell them to be there. And if it's not digitally tracked, then it never happened and it's not going to stand up in court. So having your performance reviews, your new hire federal documents, your employee handbook, everything being digital really does matter right now. And it really matters to make sure that you have it all logged in one place. And that part is what makes it really efficient, is when you have it all in one software, so you don't have to dig around everywhere. Even if you use Google Drive, I use Google Drive, I have 15 million folders. I'm not going to find all of my employees' information by using Google. It just isn't efficient anymore. And so having that software for your employee management, your employee relations, is really important to keep it all in one spot. So it's confidential, it's secure, because I'm sure you don't want your other employees to look through the other employees' performance reviews. I think that would start a lot of drama and chaos that we don't need in the practice. So make sure that only authorized users can have access to this information, and you're less likely to deal with a lot of craziness at your practice. So for this last part, we have a Q&A session, and as a quick wrap up here, I don't mean to give a sales pitch, but man, HR for Health and DifferentKind work really, really well together. I love how HR for Health can help with the onboarding and hiring process, but DifferentKind tells you, hey, we have real numbers to back this up, because if I'm shopping on Amazon, I'm going to look at the reviews before I buy something, and the same will happen at a practice. I love that DifferentKind has integrated that into the hiring and onboarding process. And how do you sell? Because there is a hiring shortage and it really sucks right now. And having numbers to back it up sounds like it'll make that practice stand out even more. And I love that you found a way to build trust within a team, and you found that it works the absolute best, and you found ways to make employees more improved and work better with patients, and you have numbers to back it up, because I think someone's going to get offended if they say, I feel like you're just not doing a good job today.
100%. Yeah. I think about, like, when we're talking about efficiency here, and a little bit before we started, right, we're talking about this idea of like elegance. And if you think about like a figure skater, like Paris figure skating, I just came out of Summer Olympics, so this is an analogy for 2 years, right? But you think about like Paris figure skating, and you have the like times when the like guy will throw the girl to do spins, right? And if you don't inherently like deeply trust that person in that moment, there's going to be a lot of problems, right? And I think that's a really apt analogy for how a lot of employees feel, right? They're getting tossed and spun, and they don't have that trust, right? And they feel like they're going to land and crack their head on the ice, and things are not going to go well. But when you have a tool, when you have a really great tool like HR for Health that can give you all of the documentation and do all of that really easily, and then you can actually have the data around, how the performance is happening of your team, and measuring that and improving that and being transparent about that, everyone's able to look at each other and be like, all right, we're swimming in the same direction. Now I'm switching analogies here, but we're skating in the same direction, and we know that we're all going to be spinning together and landing perfectly in our double lutz or whatever you're doing. So
I love it. All the analogies fit under the Olympics, so as long as we're performing at that level, we're fine.
Yeah. If we're in the Olympics, we are the top of the top, right?
All right, and so now we have time for some questions. I'm looking in the chat and I don't see anything yet, which tells me we just did a really great job at explaining things. Or if you're nervous because this is our first date together, that's fine. You can send us an email after. I understand getting nervous on webinars and maybe not wanting to have it answered in front of everyone. So if you end up having those questions later, or you think about it later after you've reviewed this presentation, please send it in. We actually do respond to the email that it will be coming from. Send it at any time and we'll make sure to respond. And let's see, we've recapped a little bit already, and I'm going to skip through some of the fluffy fluff. And the end here, thank you everyone for joining us. I know I didn't add your email, Dr. Matt. What email would be best for me to put towards everyone once we follow up with them?
Yeah, Matt at differentkind.com. Feel free to email me directly. Happy to chat with you. Really enjoyed this conversation today, Taylor. Thanks so much for having me. And these are things that we care deeply about and are super passionate about. So really excited to join today.
Awesome. Well, thank you everyone for being here. I hope that you took some tools and tips away and you see the importance of efficiency and how HR for Health and DifferentKind can get you there. It sounds like if you really want that unstoppable team, you might as well get both of us, because we're going to make it happen. We're going to give you the data to back it up, and we're going to keep you fun and compliant while we're at it. So thank you, everyone. Thank you so much, Dr. Matt, for joining us today. And if you have any questions, follow up, and I look forward to seeing you all on another webinar with us. Thank you.